It's fixed.
Fixed. Everything's fixed, so we are on time.
Always on last minute.
Hello? You will turn on the microphones?
Yeah,
or?
I will.
Okay,
Yeah.
so we are just... No, 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 don't do anything. The guy will turn them on. But do I switch it off? No, just don't do anything. Sorry, one last question. So we don't do anything with the microphones, just use them. Okay,
So it's
perfect.
always perfect. So I think that's good actually.
Yeah, we're waiting 1 minute, one more minute.
We have to see how the teams are there.
Two minutes for the teams. Yep.
Do you consent walls would be a fair sense?
Oh, and also give the clicker to the teams.
Okay, this is do you consent? Do you see pulse? Yeah. It's pulse. Okay, there's do you consent? This pulse. Yes. Okay, yes, you have to do it in the DGS which you received before to score the teams. Yeah, so we have also put extra link for, suppose you haven't scored the DRDs, but you have to maybe score the pitches. Yeah, so you have that thing as well.
But if, for example, this one, I
Because like
didn't
people are
score
still coming in and out.
Yeah, but you have a link for that. And the same thing, we've added it. The same link which you received before, we added it.
Take your phone from there and the water bottle.
Take your phone.
You have the clicker and the
Yes,
microphone?
I do.
Ready? Okay, we can start. Good morning, everyone. Okay, so I think we are ready to start the first round of pitches for Translation Potential Award of SensUs 2024. Each team will have precisely 4 minutes to present. I will start the timer as soon as you start speaking. And after 3 minutes, I'll raise my hand so that you know that you need to wrap up. And after 4 minutes, I unfortunately need to cut you off. And then we will follow with 10 minutes for the discussion. Yeah, that's it. Are there any questions already? Okay, so I think we can start. And I would like to invite to the stage TU Sense.
Hi, I'm Catalina and this is Johan, and we represent the team 2 Consents from Germany. And here I have the kidney of our patient Tom, who received his transplant in a couple of days, but he faces a significant challenge. He can't monitor his kidney state at home, so he needs to go to the hospital for frequent checkups. And this brings us to the problem. There are no suitable devices or methods for continuous monitoring of kidney state, of creatinine level, and preventative healthcare of acute kidney injury. And besides the example I mentioned before, there are some other risk groups that we identified, such as patients after major surgery, patients who already had AKI, patients who have PKD, and chemotherapy patients. And moreover, there are future growth potential groups such as hypertension, diabetes, and early-stage CKD. Alone in Germany, more than 350,000 patients per year will benefit from our product. So, what is actually our solution? We are developing a point-of-care device. It allows a continuous monitoring of kidney state at home with personalized care. So our GUI gives us opportunity to transmit the data to the hospital. So basically, the doctor will receive an alarm or notification when the creatinine level exceeds the norm, and then they will advise the patient to come to the hospital for some other checkups.
Now let's talk about our key stakeholders. So at the core, we have our at-risk patients who are the end users of our sensor. A further important stakeholder for us are the health insurers, as we want our sensor to reach as many patients in need as possible. And for this broad market adoption, the reimbursements of the cost of the sensor are very important. And last but definitely not least, we have our healthcare providers, so clinics and hospitals, as these present our primary customers. So what value do we actually provide to our stakeholders? For patients, this means reduced unnecessary visits to the hospital, which basically means convenience. The convenience is also shared by the healthcare providers as we reduce their administrative and laboratory burden. As for the healthcare providers, our sensor provides for a better resource allocation. And furthermore, through the use of our sensor, significant cost savings can be induced. This is important for the healthcare providers and for the health insurers. And our most important value proposition of all, the early diagnosis, which means that treatment can be started immediately, leading to a better prognosis and to overall improved patient outcomes. So what does the future hold for us? We estimate we would still need approximately 1 year to do further research and development and to come up with the advanced final prototype. After this, we'll start with the regulatory approval process, which means clinical trials and getting the CE marking so that we can enter the market. This would happen approximately at the end of year 3. We'd then increase our production capacity and then expand within Germany. So we'd first start in our home state of Hesse, and after that expand within our home country. We then reach a break-even point by year 6 approximately. This means this will be the first year where our revenue increases our expenses. After this, we'd continue expanding so within the European Union, and we'd finally then around year 10 or after year 10 reach a payback point. So this means all of our revenue until this point will be greater than all of the expenses until then. So also the large initial investments required to enter the market will be covered by this point. To conclude, our sensor is more than just an innovative device. It is an overall solution to a critical healthcare challenge. And we strongly believe together we can sense the future. Thank you.
Yeah, and now's the time for the questions.
Maybe I can start off then. Let me just put on the timer as well, because I'm also in charge of timekeeping. Okay, so you've talked to me before during the coaching sessions, and one thing I emphasized quite a lot was who to test. So I was wondering if you could elaborate a bit more compared to what you did in the pitch. So which patients will you test? Who are the key decision makers in deciding that? And what are the consequences for gaining access to your customer segment?
Exactly. So we will be targeting. We have narrowed down the patient groups we are targeting. So the key groups we're targeting are patients who have received kidney transplants, patients who have undergone major surgery, patients who are receiving chemotherapy, for example. And as we mentioned, there are also further growth potentials such as diabetes and CKD, but we specifically focused on these patient groups I mentioned earlier because they have there is a specific point when the condition starts, and we can basically prove our value proposition. It's easier to demonstrate the value we add for these patient groups. So we'd start with these, and then in the future, we'd be open to expand further into other patients. Does this answer the question? Thank you.
Anyone else that wants to jump in with a question?
Yeah, thank you. Yeah, you mentioned that after a few years you become break-even and then you'll keep growing also in the EU. And how do you think you'll keep growing? What is going to be your special efforts to not stagnate but keep growing?
That is a very good question and a challenge. So we will stay definitely for, as mentioned, in Germany and our home country for a while, even after the, because this is the market we know and where we have, at this point, we have the reimbursement of the healthcare providers. And we then expand in the European Union, and we stick to the Union because we have already in Germany, we are adhering to the medical device regulation, so the regulatory challenge would not be as large. But finding customers will of course be a challenge. So we live already in Germany now, in our home state. We have a great network of hospitals who we are already in contact with, and we just have to keep on working on this and find clinics, find institutions who will be our customers and to work with.
All right, thank you.
Continuing a bit on your answer to the last question, because it confuses me a bit when you use the phrase customer. On the one side, you identify clearly that the healthcare providers or insurance companies are your customer, which I can agree upon because those are the ones that pay. But if you expand beyond Germany, even though we speak of one Europe, healthcare platforms and reimbursement strategies per country differentiate totally. So I know that you need to get in contact with clinics because you need right to get in there, but any ideas on how to tackle the other countries?
Yes, this is still further along. We would definitely have to, as you mentioned, in Germany, the healthcare health insurers are critical because we want the reimbursement. Otherwise, we won't be. Our market adoption won't be that great. So we'll definitely have to, when expanding, we'd have to look into the in more detail how the healthcare system in specific countries works, and to get the health insurers on board, or specifically just modify our strategy according to the countries we're moving into. And this is definitely a challenge, but I think with time we will be working on this and moving towards it.
Your solution is a device that's taken home, and then it sends the results to the point of care. I guess there is a point, and not really a financial break-even point, but a point where a patient, and you talk about it's inconvenient for a patient to go to the point of care every time. So that would mean that if you need to monitor it like every week or daily, then it gets a nuisance. But what is the break-even point for how many times you have to measure? Like, is it like if you have to measure the creatine levels monthly or quarterly? What is the point where you say then the device doesn't apply anymore? And how many people in your target group actually need monitoring, like on a monthly or daily or weekly basis?
That's a great question. It depends on the specific patient group, how frequent. We have had several interviews with medical professionals to first of all identify these groups, and depending on the patient group, the frequency of monitoring needed will differ. The problem is right now creatinine is monitored through lab tests, so the hospital visits and the blood samples or urine sent to the lab and then analyzed. This means that it is quite inconvenient and time-consuming. So right now the monitoring is not being done as frequently just because the current solution doesn't really allow for it. So depending on patient group, creatinine doesn't need to be monitored daily. It doesn't need to be monitored hourly or like a continuous sensor, like in the case of glucose, is not really needed. But our talks with the medical professionals said that the trend line would be interesting, and even daily monitoring for this patient groups mentioned here in our pitch would make sense, and we believe our solution would really work for this.
And do you have any insight into, for example, if an insurance company has to pay the 350 euros for the device, right? For which part of the target group do they want to pay that? Do they still want to pay that if only monthly monitoring is necessary, for example?
That's a good question. We would have to we would really have to, of course, prove the value that we add, and really seek even more. As I said, we've talked with medical professionals, but even get more insight from that side. How frequent monitoring is, how frequent should it be so that it makes sense, and how the costs are, and how that aligns with what the health insurers are ready to cover. We have to adjust this and work even more in this direction.
Yeah, I was wondering with what you were saying with just once a day, that it'd be useful if you'd need once a day testing. What's the use? I'm actually a kidney patient. What's the use of wearing a device the whole day if you only need to do it once a day? Why is it a wearable then? Why not just like a finger prick thing? And what's in it for me?
Yes, a great question. So actually, our device is not a wearable right now. It is a device that is at the home, but not a wearable. So patient won't be carrying around the whole time because, as mentioned, maybe daily, maybe even twice a day, but probably not more. So we don't see the right now we don't see the need for it, and also right now our technology doesn't allow for it. We will continue with research and development, and the future vision definitely is towards wearables, and maybe combine it with other biomarkers. There we would see the value. But right now we will start with a stationary device that will be at the patient's home, and the patients can measure it once or twice a day, for example.
Okay, thank you.
Thank you.
My question kind of continues on the previous question. You have a pretty broad target group, 3 different kinds of patients. Have you researched what the benefit is for your product for each patient group? And how does this translate in your product design?
Yes. So for the patient groups we mentioned, they all have a significantly elevated risk of acute kidney injury, and as mentioned, they all have a specific point where the condition starts. So, for example, after transplantation, the patient definitely profits from this continuous monitoring. Also, the reduced visits to the hospital come into play. As for chemotherapy, there's a lot of cancer patients, and these nephrotoxic medications also elevate the risk. And once the treatment with chemotherapy has started, also then the continuous monitoring makes sense. This is what we discussed in our interviews with medical professionals.
Have you interviewed patients in this target group?
Sorry, could you repeat, please?
Have you interviewed patients with in your target group? Because I can imagine, from a medical point of view, continuous monitoring can really help. But I can also see that within these 3 different patient groups, their lives are really different. So how does your solution fit in the lives of your patients?
Yes, so you have something?
Yeah, maybe I could tell a little bit more and answer this question. So one more time, like it depends on the patient group. And as my colleague answered the question, there are some different types, and for example, also PKD. So these are, it's actually a genetic disorder.
I have PKD. This is useless for PKD. All of them are useless for PKD.
Okay. So as what we researched, that we the information with what we found. So basically, it's based on the information that we found. Yeah. Yeah, I don't know. Do you want to say something more?
Is there a minute? Could you please repeat?
Yeah, it's okay. Thank you for your answer.
Let's just close it off here. We have to stick to the schedule. I'm sorry for the not having your answer, but I think it's a broader discussion.
I think you can move on.
You specifically mentioned that it's good for PKD, then
Thank you.
Yeah, thank you. So now I would like to welcome Pulse.
Yeah, that's it.
Is that my phone? Guys, I'm so sorry. Just 1 second. It's really embarrassing. Someone sent me something. Yeah, I'm so sorry, guys. I just had to chat with my support group on the CreaView app, but yeah, I'm here now, and I'm just getting a little ahead of myself, I realize. So let me start with the introduction. Let me start by talking about acute kidney injury, or AKI. And as we all know, because it's the theme for Census 2024, AKI is a loss of kidney function, which leads to an accumulation of waste products in blood. And it's a very prevalent disease. It affects 10% of the world's population, which is 800 million people. And it doesn't affect just the kidneys. It affects every single other organ in your body. So the fact is, if your kidneys don't work, then the rest of your body doesn't work, or, well, you don't work. And currently, the patient journey for AKI looks like this. So first, the patient needs to get an examination from a nephrologist, after which he gets prescribed a treatment, and then he needs to monitor his creatinine levels 3 to 4 times a week, and this causes a number of challenges. Well, there are lots of travel costs. Obviously, if your kidneys don't work and you have to go to the hospital 3 to 4 times a week, it's a problem. And creatinine levels vary with circadian variations, and they vary with different diagnostic labs, and these variations can cause a very incorrect diagnosis. And we saw this at Team Pulse, and we thought, well, we should do something about this, right? And so we came up with CreaTrack, a wearable continuous sensor that is made for patients. CreaTrack is a wearable sensor which is very comfortable for the patient. It offers continuous monitoring, so the diagnoses are accurate, and it is connected to the app I showed you, the CreaView app, where you have access to doctors and a very friendly CreaView community. And we give all of these at a fraction of the price. And it's not just for patients, it's great for doctors, it's great for the entire medical system, because now doctors have access to continuous and accurate creatinine monitoring, and hospitals there's less strain on medical and diagnostic infrastructure, which in turn will lead to a higher patient flow and a higher revenue. Now, who are we going to sell this to? I'm glad you asked. So, because we have identified two main markets. The first one is CKD patients, or chronic kidney disease patients, which need their creatinine monitored for a long time. And then we need to use it for the post-organ transplant patients. And these guys need to monitor it for a short time just to make sure that the organ transplant is successful. And finally, we have also identified an exploratory market for the later stages. That is that of the high-endurance athletes. And these athletes can use it to monitor their creatinine levels and check that they're not getting dehydrated due to their intense training. And to sell it to these patients, we have made a simple 4-stage plan. The first stage is R&D clinical testing. We're going to take 3 years, make our product perfect for the market, and spin off in 2025 to accelerate our growth. After which, we're going to try to penetrate the Benelux market, make relationships with doctors, patients, and other medical professionals, and establish ourselves and break even at the end of 2028. After that, we want to expand aggressively into the Benelux market, join government insurance programs, make sure our product has a wide consumer base, and finally expand in EU, monitor other biomarkers, and also target our athletes. And we also made detailed financial projections for this, and the highlights of that is that we break even in 4 years, as I've said earlier, and there's 2 million funding raised, 1 million for our seed funding, and 1 million in year 4 for expansion. And I would just like to conclude with this quote, which said that the best way to predict the future is to create it. And at Team Pulse, we want to create a better future for AKI patients. Thank you.
Well, thanks a lot, Team Pulse, for your presentation. Let's have a look at my fellow jury members if they have any questions, or perhaps you can. Would you like to start to pick up the discussion we had before, or not?
It looks like you have very clear target audience, which I liked, and I enjoyed seeing that you also realized that it's that kidney disease affects all our other organs too, and really affects your life, and it seems that you're focusing on that. And I would like to know, so the adding on to the athletes, that's really an afterthought, or is it, or like an after extra thing, or is that something you're already focusing on too now?
It's something that we want to add on later, because the fact is, if you want, creatinine level is not like a very good dehydration sensor, like the sweat sensor can probably do a better job, but if we add our creatinine levels to other biomarkers like potassium, like sodium, like the electrolytes, then we develop a much more complete picture for dehydration. So that's why we want to target it in phase 4 when we are already settled in the market, we have a brand, and then we add other biomarkers, and then that's our market to grow, basically.
Okay, thank you.
Sorry, just to add on to what my friend just said, it's also we did some validation for it, and some of the research institutes and health psychologists wanted something like that. So we decided that it will be better to work after we have a good product in our hand, but we already have some validation for that idea. It's needed.
Perhaps as a follow-up question, so you have a kind of a roadmap of development on the different customer segments you want to target. I was wondering to what extent there are also synergies between those markets, and do they really require the same type of solution, or can you build on the same technology? Can you please explain that a bit more into detail, while it makes sense from a technology point of view to develop it that way?
Yeah, that is the plan. Yeah, we want to add on to our technology of creatinine sensing, add other biomarkers possibly, and then sell it to them. But with our two markets, which is the CKD patients and post-transplant patients, our relationships with the customers, with our medical providers will be the same for both. We want
and to understand the product, because I would expect that post-transplant patients are in the hospital while you do the measurements, or
they are in the hospital for a short time, and then they can get discharged earlier.
What can I imagine in terms of duration of measuring for both groups? Or I'm just trying to understand if the nature of the solution really fits with both customer groups.
Yeah, so for CKD, it's a chronic condition, so it's a much longer one. So for post-transplant, what we heard from our doctors were 4 to 6 months. After the transplant, they need to monitor it, and they give immunosuppressants to to the post-transplant patients, which, yeah, that's what, so the immunosuppressants affect kidney function, and yeah, so they need to monitor their creatinine levels to make sure their kidneys are not damaged while they're replacing their lungs or
Okay,
something like
but
that.
so then you definitely also move to a trajectory of home monitoring.
Like the technology part of it doesn't change. It's just that for the post-transplantation patient, it can be used for a shorter amount of time. For the chronic patients, they just have to buy it and use it for longer, but the technology stays the same.
Yeah, and what are the main risks you foresee in bringing your product to the market?
Yeah, we can divide our risk to a number of categories. So if you see like the technical part, well, we have to make our sensor wearable. So currently our sensor is potentiometric, which is like good for miniaturization, but yeah, to make it wearable, to make it small, to still sense our signal is a challenge. Additionally, like transportation, logistics, storage, because our sensor is a cartridge model, so what happens is, yeah, there's a bulk electronics part and a cartridge that has to be replaced every 14 days. So to deliver the cartridge at the correct time to make sure the enzyme activity is there. We also can say we have some legal challenges. We foresee that we get CE approval in 2027. That may not happen. And yeah, so these are, I think, our various challenges that we have to tackle.
Okay, thanks.
I have a question about your choice to expand into the athlete market. When I look at you want to go into the healthcare market first, I think the risk of failure there might be higher than with athletes, because if you fail with like kidney disease patients, then the consequence of that might be, as you say, your body might stop working. Whereas with athletes, the risk there might be that you're a little bit dehydrated with training. And isn't there a case to be made that, especially with certification of the product and being suitable for the healthcare market, that actually the athlete market is way easier to enter, and you can use, like it's being used by top athletes to later on go to the healthcare market? And did you consider that?
Yeah, we did consider that. Is a very good point. Unfortunately, the number of athletes that are going to use this is very small, like ultra marathoners or Ironman triathletes, which are just not a lot of people. Like, so we actually looked at this market first, but we realized we're not going to be profitable if we start with athletes. And so that's why we want to add other biomarkers, make it like a better sensor for all kinds of athletes maybe, or even the general public, because normal people don't need a creatinine sensor. So, and like ultra marathoners who get like severely dehydrated, they might need that.
Or like a normal person who is going for, or like any normal person who decides to suddenly start training for a marathon, they will, undergo enough muscle loss to actually register creatinine. So it's more like a training sort of sensor than something that they will actually wear during the competition. So, but the market is so small that it can be like something add-on onto the actual CKD market rather than something that can be like something to launch a product itself.
Something to think about. It might not be profitability, but it might be early testing and validation that might make it interesting, because you might be able to earlier test on actual people than in the healthcare situation.
Yeah, that's a good point. Yeah, we could try that in the leaders.
You just stated that your plan is CE/MDR regulatory approval in 2027. I'm assuming you're targeting regulatory approval on the wearable or on the current device?
On the wearable device.
And how much time is it going to take you to miniaturize the current model into a wearable before you can start testing the wearable to provide the data to then submit to the MDR?
Yeah, so the idea is that if we can switch to a wearable within the next year, then we apply for a patent at the end of 1 year, and then while the patent thing is going on, we generate the data so that we get enough data for the CE because we can't enter a market without a patent either. So like while the patent thing is working and we have a provisional patent, we can work on all these other approvals and generating the data and stuff like that. I mean, yeah, it's a lot of parallel stuff, but.
Quick question on the wearable. Looking at your target group, what is the benefit over continuous monitoring for them compared to like monitoring once a day? Like, what is that a nice to have, or is that a must have for them? And for how many is that a must have?
I think it's a need to have. I don't think, because, well, as I said before, like creatinine varies with circadian rhythm, so your creatinine in the morning is not the same as your creatinine in the evening. And also, we also found a study which said that variation between different diagnostic labs is up to 60%. And so this is like a very big variation which can lead to a very wrong diagnosis. So if we have accurate continuous sensing, we account for all of this, and we give like a better thing, and we do it cheaper also. So that's another nice to have.
Yes, let's have a look at a question from the audience.
Right. I was very positively surprised that you only need 2 times 1 million, so in total 2 millions of investment. Could you explain, like, what did you account for to make such a medical product for this amount of money?
So the current value is kind of an estimate. So we have, yeah, so this is like some details of the costs we needed for scaling up. The one on the right side is like expense sheet for like the first level of scale up, where we are kind of, setting up like a small scale factory in like a bio incubator in Leuven. On the left side is like sensor cartridges, and we had some for the regulatory approval, some for hiring lawyers, a few. Can you go to the next slide, I think? Yeah. There are some costs for R&D, depreciations, and like, yeah. It's more like a bit of for the research, for the R&D, for having lawyers, for the patent and stuff. We might get a lot of help from our KU Leuven University itself, from which we will spin off, because we have a good tech transfer office. So we plan to have some kind of, help with that aspect as well.
And how many people will be working in your company?
During the first phase, we have like around 9 people, I think. Yeah. And then in the later phases, after year 4, we plan to scale it up to 15. But we also plan to automate it around that. That's why we need the extra million, so that we can buy more equipment to kind of parallelize some things, so that we can, scale up our production as well.
All right. Yeah. Thank you.
Thank you.
Thank you, everyone.
Just click for this. Yep.
Okay, now I would like to welcome BioSense EPFL.
I think, can we give them a second microphone? Yeah, I mean, if both are going to speak.
We only have one, pass back and forth. Okay. Sorry. 9 million. It is the amount of people in the US that could benefit from our device. This is why at BioSense EPFL we are focusing on targeting the interconnection between kidney health and heart diseases. In fact, 90% of people suffering from chronic kidney disease die due to heart-related conditions. On the other hand, chronic kidney disease affects the pharmacokinetics of drugs used in the management of heart failure.
Do you see a vicious cycle forming? Imagine a future where heart and kidney diseases are caught before they spiral out of control.
This is the reality Nephropal is creating. Nephropal is a wearable biosensor that continuously monitors 2 key indicators of kidney health, creatinine and potassium. The sensing principle it relies on is the ion-sensitive field effect transistor technology, coupled with enzymatic reactions. Additionally, our prototype features a user-friendly smartphone app to which data is securely transferred and then saved. These elements altogether ensure the best experience to both healthcare professionals and patients.
You could choose Nephropal over the competitors like Let's Get Checked or StatSensor due to the following reasons. First, effortless monitoring. Nephropal takes the burden of patients by eliminating the need for active monitoring. Second, comprehensive testing. Nephropal measures both creatinine and potassium, providing a better picture of kidney health.
Third, by bypassing lab delays, we can offer immediate results. As a bonus insight, because of these very unique advantages, the Italian Society of Nephrology was eager to validate our device, even at the prototype stage.
We are targeting $20 billion US market with 9 million patients. This is a large and homogeneous market, meaning that the regulations are consistent across the country, making it easier to scale. Moreover, US is receptive to telemedicine, which is a key thing for a device like Nephropal. And we would sell Nephropal as a product as a service model. For $1,300 per patient, Nephropal provides sensor, real-time data access, and ongoing service, saving hospitals around $1,000 per patient.
Our go-to market strategy focuses on diagnosis-related group hospitals, or DRGs, to which insurances pay a fixed amount per diagnosis. By targeting these hospitals first, we can bypass the complex insurance reimbursement process, making the entry to market of Nephropal easier. Additionally, healthcare professionals, with their clear understanding of disease complexity and their proximity to patients, are likely to quickly recognize the benefits Nephropal brings. In the first year, we aim to raise $2 million from EPFL grants and US venture capitals to scale our prototype to a product. Then we will set up the production in Minnesota. We chose this location because of its established biologistics, low production costs, and skilled workforce. On the regulation side, we aim to get the 510K FDA clearance, which only takes 6 months. This is possible because our device is a Class 2 medical device.
Once we have demonstrated significant cost savings in DRG hospitals, we will approach the insurance companies that cover them. Our message would be clear. We already helped your DRG hospitals save money with Nephropal. Now we want to help you to save money across your entire network. On year 3, by scaling Nephropal to the insurance companies, we will be able to generate $28 million revenue and $6 million profit. Finally, we wanted to thank our supporters across academia, biomedical device industry, as well as exceptional medical professionals we had an opportunity to work with. Let's build a healthier future together.
Okay. Time for questions. Who has a question or who would like to kick off?
So you're going to make an app with a continuous monitoring wearable. Why did you choose to make an app for the specific patient group you targeted?
Because we thought the advantage is that the app would be the conscious that is thinking about the disease and not the patient anymore. So the idea, and it's the reason why we also decided to go for wearable, is that when one has a disease, it's a burden. And we didn't want that anymore. And so what we saw in the wearable is not that much that creatinine has to be monitored all day long, because as the previous team said, it varies too much. So it's not something like glucose that we want to monitor continuously, but the fact that the sensor is working on its own and then the app is only showing up when something alarming happens, it makes the patient live their life better because of the fact that they can forget a little bit about their disease. They know that the app is alerting them if something happens.
Yeah, and practically speaking, each patient is different, and there's a lot of different
of course.
age groups as well within the target group you designed for. And I can imagine that, for example, elderly people have maybe difficulty using your app. So did you validate, or how did you research that an app is the best solution for you?
We asked professionals about that because we were also wondering whether we should have a separate device that connects to the part that is wearable, and if that would be better. And the answer was that the elderly people they interact with, either they ended up having a smartphone for other reasons, and so they would still have the smartphone, or they are often accompanied by someone else that is able to help them with the smartphone, and for which the smartphone would be easier to interact with rather than something else. I wanted to add something, but I forgot. But yeah, it's from them that we got the fact that go for an app, it's what people will prefer. But then again, it's very specific to people. There were professionals that also said, I have people who would prefer the app, and I have people that would not, so.
Okay, one last question. Did you also talk to people besides healthcare professionals?
Yeah, we talked with some patients, but of course we did not have all age groups. But the age groups we had, they were all agreeing on the app, mostly because they all had a phone. They specified it has to be easy to interact with, which is what our team, the part of our team that has been doing the app, tried to focus on. But they all wanted something on their phone just because the phone is the thing they have close to them at all times.
Okay, thank you.
I want to continue on this line of questioning because, for example, when you are a diabetes patient and you can read like how, if you need something, the action you can take with seeing, if you need insulin, for example, you can actually take an action. The same with if you monitor like with a Fitbit or something, your training stage, you can see, oh, I have to take rest.
Yeah.
What action would a patient take if they would see that the creatine level isn't high, or if it's too high or too low? What action would they take from that?
So it depends on the gravity of, no, not gravity, but how bad the situation is. If it's a very alarming situation, we thought of it being connected with the hospital that takes care of this patient, and therefore both the hospital and the patient would receive an alert, which would mean go to the emergency room. If it's not at that stage, they would just receive an alert that would mean contact your healthcare professional, and the healthcare professional would also receive something saying this patient might need a checkup.
So is it fair to say that it would be where you want to provide peace of mind? It's actually you suddenly have an app that you can monitor and you're constant. I would be looking constantly at the app like, oh, do I need help or not? And it wouldn't actually provide me with peace of mind.
But also our device makes it easier to notice the onset of a major condition earlier, because basically we are targeting a group of people in which heart and kidneys are both not functioning well. And they are on some specific meds like ACE inhibitors, for example. And when they are taking these medicals, their kidney state can worsen quickly. And that's why basically we need our device to help them to understand the onset of these conditions earlier, as soon as possible, so that they can just go to the hospital and change the course of their treatment.
Any other questions from the jury? Then can I jump in? Okay. During your presentation, you mentioned something about cost savings you expect to realize for the hospitals. I was wondering if you could unpack that a bit and explain, what exactly, in what different elements of costs hospitals can save upon by implementing the solution.
Yeah, so if I can find the slide and if you can see it, but basically the main costs that come for the hospitals for this category of patients is because they notice the onset of deadly diseases later than they should. And we found some literature that says, like, if you notice the onset of several conditions later, then you risk of X amount of % of worsening of the situation. And then we found out how much money they spent annually on patients when these conditions are met. And that's how we calculated this, basically the cost of lately diagnosing the onset of some deadly condition.
So it's mainly because of the not capturing, how do you say it, complications early on, leading to more costs for that particular patient in the end.
Yes, exactly. So basically we are helping them saving money because we can detect the onset of stroke, for example, earlier, and then they save the money because of that.
So that seems more of a, I think there's definitely then a societal gain from your solution. But I'm also trying to understand what would be the incentive of a hospital, and perhaps so then, and within the hospital you have doctors that look at how the patient is at heart, but there's also a financial component to their decision making. And sometimes we see that the way health insurance is organized, for example, does not really support telemonitoring solutions because it allows for less invoicing towards patients because part of the care moves from the hospital setting to the home setting. So is that something you look into?
Yes, basically that is the exact reason why we decided to go for DRG hospitals, because you know there are different kinds of relationships between insurances and hospitals, and these DRG hospitals get money from insurances according to the diagnosis of the patient. So they get the fixed amount of money from the insurance for a specific patient when he has a diagnosis. And basically that's why they have a direct incentive to cut their costs, because like they won't get any more money from the insurance.
Okay, so but then the insurers do not really gain from it in this model, because they still pay the same amount per patient, and then the hospitals do it more efficiently.
Yes, we have two-stage strategies. So on the first stage, we target these DRG hospitals, and then on the second stage, we use these successful use cases with the DRG hospitals to go to the insurances and just say, hey, like you cover these DRG hospitals, and we saved them X amount of money. Now we can save you the same amount of money.
When you talk, you target the US market, but when you talk about the DRG hospitals and the insurance, do you mean the insurance companies, or do you mean that they're covered by Medicare and Medicaid, which are not the insurance companies?
No, it's mainly insurance companies.
But I think the DRG hospitals are linked to Medicare, and that's the way how Medicare like sees what they want to reimburse and how.
No, it actually depends mainly on the size of the hospital. Like it's true that part of DRG hospitals are covered only by Medicare and Medicaid, but also there are big hospitals, for example, the Minnesota Central Hospital that we were talking about, which are covered by specific insurances.
Okay, and okay, if that is the if that is the case, you started off with the 9 million people. But how many of these 9 million people actually receive their health care through insurance companies and not through the Medicare and Medicaid system? And how many are there then left within your target group?
Basically, according to the statistics of that age group, around 30% of people get their money from the Medicare and Medicaid, and the rest are covered by private insurances.
I think that's sufficient for now also, since time's up. Thanks a lot.
Okay.
Just click through the slides. Yes. Oh, perfect. And now it's time for Biosensum.
So did you know that the mortality rate associated with AKI is 23%? That means that more than 1 in 5 patients diagnosed dies from this condition. AKI, or acute kidney injury, is the sudden loss of kidney function due to a kidney straining event. For example, heart and renal surgeries are events that are very stressful for our kidneys, and in fact 20 to 30% of heart surgeries end in AKI. So to solve this problem, hospitals closely monitor patients post-operative in order to be able to react quickly in the event of kidney deterioration. Unfortunately, costs associated with hospitalization are very great, with an average of $2,833 in the US per day. So this is where SensUs comes into play. Our biosensor combines the sensitivity of electrochemical detection with the continuous monitoring potential of aptamers. And our prototype validates this principle by showing the great promise of the development of a continuous monitoring biosensor. Unfortunately, our prototype is bulky and impractical. Our end goal is to translate our technology into a lightweight, easy to use wearable patch that patients will be able to bring home while still being closely monitored by their nephrologist. So our product targets several stakeholders, including hospitals. We will be able to reduce hospitals' costs by being able to discharge patients earlier while still closely monitoring their kidney function. Pharmaceutical companies will also be interested in our product, especially for drug development. So FDA regulations in the United States require drugs to be tested for their impact on the kidneys, and our biosensor could provide them with concrete data regarding creatinine levels. Doctors and nephrologists will be able to make rapid decisions based on continuously monitoring creatinine and allow patients to have better outcomes and satisfaction.
So for our business model, we will have a consumable, the wearable patch, and that will be accompanied with a software license. We'll also provide customer service, training, and customer support to ensure the quality of our device. Our wearable patch will be sold at the cost of $250. While the cost of production is only $47, it is taken into account that we have multiple high-cost production contracts that will ensure lowering the cost. The institutional licensing fee will be at $20,000 per year for the hospital, but it will be for the whole hospital, allowing all patients to be treated and without limits. In US hospital, there is 183 heart surgeries in average. 183 heart surgery in average for a hospital in the US. That means that if our product is used by 100 patients, it would cost $45,000 for a hospital. While that may seem high, it's actually pretty good for the hospitals, since one hospital has to having to keep 100 patients for one more day would cost $2,088, around $3,000, and that would result in $300,000 for all the patients. For the roadmap, we will start our fundraising with $1 million on the first year.
Sorry, unfortunately, time is up, but you can finish the sentence.
Yeah, with $1 million for the first year and for $1 million on the second and fourth year for seed and Series A of raising fund. Sorry. Thank you for listening to the pitch. Sorry.
Okay, thanks a lot for this presentation. Let's see who would like to kick off with a question. Yes.
So do I understand it correctly that you're basically not targeting this to individual patients, but really just to the hospitals, to people in ICU, and it's...
Yeah, so exactly. We're not targeting patients. Our customers are actually the hospitals.
Okay.
And but we're targeting our use case are post-operative patients.
Okay.
Because after talking to several nephrologists, they told us that patients stay in the hospital longer to be able to continuously monitor their creatinine, because, like I said, they're at great risk of developing a loss of kidney function.
Mm-hmm.
So even by allowing patients to be released one day earlier, we would enable hospitals to reduce their costs by a lot.
Okay, thank you.
If I may jump in, so if you're targeting post-surgery patients and the aim is to, so I'm trying to understand the nature of your solution, and if you measure in the hospital, and the aim is to send them home more quickly, wouldn't that also require a home monitoring solution? Or I'm just trying to understand what exactly you're offering within a hospital setting and how that is better compared to what they currently do.
Okay, so the aim would be to give the patients the patch, and then they would be able to go home.
Okay, because I was a bit confused with the answer to your question, because then it seemed like a hospital testing device rather than a home monitoring device.
Yeah, so currently they test in the hospital with their laboratories, but what our solution adds is that you would be able to go home, therefore saving costs.
Okay, and you put them on the sensor the moment they go home, or you would be testing them for a period in the hospital as well, right? Like,
Yes.
to decide,
So,
okay, this is a stable patient, or
Yeah, so nephrologists have told us that patients would probably still be in the hospital for a few days after because there are other, they've just undergone surgery. So there would be other things that they would have to monitor, make sure the patient is stable. But even if you're able to release the patient one day earlier, it would still save costs to save the hospital money.
yeah, and what would your biosensor offer in terms of information that allows doctors to make that decision?
So yeah, since doctors will have already looked at their creatinine and probably done a blood panel at the hospital after their surgery, they will be able to measure their glomerular filtration rate and their creatinine levels. So basically all they would have to see is are their creatinine levels steadily rising? And yeah, that's why it would be important to continuously monitor it. They wouldn't necessarily have to look at the full blood panel because they've already had that information from their lab tests that they do at the hospital.
Basically, they have more detailed insights in how patients are developing
Yes.
post-surgery and can make better distinction between.
Exactly.
Okay, thanks. Any other questions from the jury? Or
No, that was my question.
okay.
And yeah, how do you plan to position your product against the potential competitors in the market? Yeah, or do you know any competitors in the market?
Yeah, so in Canada, there's, I think, only one other continuous monitoring device on the market. It's called MediBeacon. So MediBeacon doesn't measure creatinine levels, and their targets are different. So the advantage of our biosensor, well, first of all, as a wearable patch, it would be easier to use, and also it enables to measure creatinine, whereas our competitors measure another biomarker.
Hi. You guys had quite a significant markup of like close to 500% on your cost of production. Could you just justify a little bit more how you're getting to 250 per unit if you're producing for 47?
So basically, we have to cover the cost of production. Miniaturizing the patch is quite costly since we have to for the microchip, for the microneedle, and the process of having, as we said, electrochemistry. So yes, it's kind of a big margin, but it's actually fair since we have quite high costs on that side.
But I thought the cost you showed was $47 and your sale price was $250.
Oh, sorry, R&D costs. Like what I meant is that we have high R&D costs through contracts, and we have to cover them since we sell them at $250, and we have to produce them at $47. Did it respond to the question?
I think so. More questions? Yep.
In the beginning of your presentation, you also mentioned something about pharmaceutical companies being an important stakeholder. It made me wonder how they fit into the story you brought about having this post-surgery focus and how they are beneficial to that strategy. So what are the synergies?
Yeah, so pharmaceutical companies are sort of outside of our problem. We would target this very specific case of post-operative first, but we could also expand into research and pharmaceutical companies later. But you're right, it's not directly related to a post-operative.
Okay. And it also wouldn't be like a first collaboration that helps you in building expertise, credibility to then target. You don't require them as a partner to target your main customer group. No.
No, we don't require them as a partner. They would actually be like a separate customer segment.
Yeah, because I can imagine perhaps they just divert attention and resources by doing so. That's why I wanted to understand.
Well,
the rationale
actually,
for
we
doing
were
so.
told it might be easier in the beginning to target research with regards to post-operative because
that would have been my reason.
Yeah.
And I wanted to see if that was indeed the case.
Well, we're still exploring.
Okay.
Yeah, but yeah, pharmaceutical companies might be easier as a first target, but yeah, we don't know yet.
Okay, we do have time for some more questions. Anyone else with an urgent question or less urgent question at this point? No, in that case, we close it off here and then perhaps gain a bit time in making the schedule for today. Thanks a lot for your presentation and your Q&A.
And now the last team for this round. Yeah, I would like to welcome Secretum.
Thank you. Can we start? Yes. Hello, my name is Anna, and here's Valentin, and we representing Secretum team from Munich. Our team has been developing a novel, original biosensor for creatinine detection. It employs the most modern biological approach. The aptamers are the main players in our biosensor, and it ensures the continuous wearable and smooth measurements. And it would help not only patients all over the world, but also will attract the healthcare professionals. At the stakeholders, we see the hospitals, dialysis centers, and health insurance company probably. Here you can see the key points of our patient journey, and our biosensor is deeply rooted into all the processes. Initially, it helps doctors to plan the treatment, to decide on the stage of the disease, and then it can be used for planning the operations and dialysis. After research into medical devices market, we confirmed that our solution is addresses the growing demand of the accessible and accurate medical devices for diagnosing. And moreover, we created a solution which is eco-friendly. Our reusable electrodes can be returned monthly and then switched anew for the subsequent ones. Also, we utilize the reusable plastic.
Thank you, Anya, for the insights. Now I'd like to walk you through our business model. So first of all, let's cover the sensors. I can tell you two strengths of it. First of all, being that it's very generalizable. So you can capture not only creatinine, but also other molecules at around 100 daltons of weight. The second point is that the sensor is also quite faster than the conventional methods that take, say, 15 minutes to half an hour. Our sensor will be only a couple of minutes. That's the goal, at least. Secondly, I'd like to cover the team and the important roles in our team. We obviously require engineers to produce the hardware, the electrodes, the microfluidics, and so on. Secondly, we need biologists and chemists to develop the method and to engineer the aptamers. And of course, in order to process the signals, we'll employ developers, and to present them to the public, we'll use UX managers. And furthermore, in order to realize the project, of course, we'll hire sales managers. After that, it comes to the marketing. And marketing, I like to highlight 3 points. The first point being spreading information about our product on social media. Second point, of course, we'll provide brochures to hospitals and also dialysis centers. And the third point, we'll provide evaluation units to all who is interested for them to test our product. Now, what's in there for the patients? The patients will get a wearable device that can continuously monitor their health. And also, for stakeholders. Stakeholders will be able to reduce the loads on hospitals throughout using this device. Also, they will be able to embed a telemedical device into their workflow.
Sorry, the time is up, so just finish the sentence.
Yeah, thanks for attention. And we'll be eager to answer your questions.
Okay, thanks a lot. Let's see if we can help you finish your story by the questions we have. Anyone that would like to start? Sebastian?
I was already writing down the question of what I guess you didn't finish in the presentation. So the current contest is focused on measuring creatinine and creating solutions in that area, right? I heard you stating that you provide a platform technology, apparently, that is capable of measuring more biomarkers. So somewhere you're already down the line thinking of multiple other applications, whereas I'm still stuck in the fact, like, who is your first launching customer and how are you going to reach them?
I think our first customers, exactly the hospitals that need the creatinine detection. Yes, we mentioned this because our models for the aptamers creation can be adjusted to all the small molecules like creatinine. So in the future, we would like to test them with other molecules.
I guess the question would be, and then the question gives you some space to say more. Could you elaborate a bit on your first launching customer, how to get there and how to get traction so that you don't fall over before you get started?
Okay, as we said, our first customer is supposed to be hospitals, and so we'll do more research into how exactly those sensors are employed in, say, medical in the emergency, and we'll try to target them. Because for them it's quite important to be able to measure quickly, and so helping them to reduce the time from 15 minutes to, say, 3 minutes will be really helpful and will save lives of patients. And so we will conduct more research in that matter, and we'll talk to hospitals about whether they would be interested and which requirements exactly they have for this. Do you have anything to add? No.
My question was actually kind of in the same spectrum. Which patients are you talking about? Because like patients who need creatinine monitoring, we've heard, yeah, that can be any patient, and I doubt you're planning to just stick it on everyone who walks into a hospital door. So I'm sure you've thought about which actual patients you're targeting.
Yes, here you can see. Sorry, our actual patient is the patient with kidney diseases that comes to the hospital and firstly noticed that he has some problems, and then he started the monitoring. While he's under the monitoring, the doctor decide on the treatment planning and decide on
if this patient will need the dialysis or if this patient will need the operation. Yes.
Have you talked to nephrologists or kidney patients? Because if I look at that, I'm thinking that is very different from how either acute kidney injury or a chronic kidney disease actually progresses.
We didn't talk to exact persons, but we will do that.
Okay.
There's still time for a question?
Well, I forgot to keep.
Okay, then I will keep it short. Okay. To continue on the previous question, can you please explain a bit more on how you validated the research you did for the translation potential?
How we validated what?
The research you did. So did you talk to people? Did you interview patients? Did you only do literature research? What was your approach? And what do you still need to do?
Yes, of course we did the literature research, and we talked to some doctors in the Ludwig Maximilian University, and our supervisor was advising us. And of course we need to go to the hospital and to talk to patients and to talk to doctors that are really involved in this team. Yeah.
And have you thought about what impact that can make into your proposition you just presented, and how you're going to adjust that?
Could you please repeat the question?
Well, talking to patients and talking to doctors may give you a lot of insights that may help support the presentation you just gave, or change it. How have you thought about the impact it could make, that the further research needs to be done?
I guess somehow change it and somehow support, yes. Because, for example, from the patient side, it could be interesting to listen to the patient conveniences, like what is better for them, how many times they want to go to hospitals, to visit doctors, yes. And from the side of clinics, we want to know more what do they need from our biosensor, how to improve the whole cycle of the patient. Yeah.
In your business model canvas, there is in the middle, there is high-level concept, and there's a really intriguing sentence: Fitbit for kidney health. If you close your eyes and imagine the person that uses a Fitbit, your Fitbit for kidney health, how old are they? What do they do? And by wearing it, how is their life any different from not wearing it?
It's not for every person. It's a person who noticed that he has a disease. Yes, for example, from the first stage of the kidney injury, he started to wear this device, and yes, it helps him to be not so nervous, and it helps the doctors to plan the treatment. Yes, in this case.
Also, if say doctor has, if the patient has to go through multiple checks of creatinine level, the doctor could prescribe our sensor to the patient in order to control his health condition throughout the time. It also could help the doctor see how the creatinine level progresses and whether any drops or higher ups. So this is partly the goal.
And maybe it's a he, apparently. I don't know why. There is a reason for that. But how old? What do they do? What do you imagine their life to be?
Yes, of course. Patients with kidney diseases are not so they are not into sports and so on. Yeah. No, but I think patients in the last stages of kidney diseases. Some patients, okay, so in our research, we were thinking about the person, the man with the obesity, 57 years old. Yes, he had the diabetes, yes, and yeah, he's going through our patient journey.
Thank you.
I think let's close it off here because I think we started at 8 to 12 with you. So
Yeah, thanks for the great questions.
Yes, and this is the end of round 1, and now there's a break. So welcome to the hallway.
I think there was a bit of confusing on our side about if we could change our slides, and we uploaded yesterday evening.
Did you send it to?
We sent it to treasurer at SensUs.